Hello and welcome to the COPD and Caregivers webinar. November is COPD Awareness Month and National Family Caregivers Month, and the COPD Foundation, Caregiver Action Network, and the National Heart, Lung, and Blood Institute have come together to share their activities and initiatives for the month. We are inviting everyone in the COPD and caregiver communities to take action this November. We have with us today Dr. James P. Kiley and Dr. Puntieri of the National Heart, Lung, and Blood Institute, and John Schall, CEO of the Caregiver Action Network. I'm Fabiana Talbot, Director of Communications at the COPD Foundation. We are going to start things off today with some statistics from Dr. Kiley of the NHLBI Learn More, Breathe Better campaign.
Today we're going to learn about chronic obstructive pulmonary disease, or COPD. This is a serious lung disease that over time makes it hard to breathe and causes a long-term disability. Nationwide, more than 15 million have been told by their healthcare provider they have this disease, and it's estimated that millions more are unaware that they may have the disease. Each year, COPD claims thousands of lives. It's the third leading cause of death following heart disease and cancer. In 2014, more than 140,000 individuals died of COPD in the United States, and slightly more women than men, which has been a trend that we've observed since about 2008. We estimate that the annual cost of COPD may be as high as $50 billion, with $36 billion in direct healthcare costs and $14 billion in indirect costs, such as lost wages, etc. That includes that of both the individuals and the caregivers. Costs to employees and impaired work performance costs all factor into these spiraling healthcare costs. Not surprisingly, COPD is the second leading cause of disability, and 1 out of 6 people with a disability have COPD. So you might ask, well, what is COPD? Well, at first, the signs and symptoms of COPD are quite mild. In fact, many people may not even have any symptoms. They may just have a slight breathlessness. But people over time will develop a more difficult time breathing, and often people will discount those changes as a lifestyle change, or maybe they are having difficulty because they're older or they're just a little bit out of shape. As the disease progresses, those symptoms become progressively more severe. Common signs and symptoms include coughing, shortness of breath while doing everyday activities, and inability to breathe easily or take deep breaths. Oftentimes there's an excess sputum production and some wheezing, and not all of these things occur at once, but do gradually occur over time. We also know that women are more likely to be diagnosed with COPD than men. 66% more women than men, and we also know that more women die from COPD than men now. There are a few risk factors, with a history of tobacco smoke as being the most common. The majority of COPD cases occur in current or former smokers. About a fifth of those with COPD have never smoked. So exposure to environmental pollutants such as dust, chemicals, fumes in the workplace, or indoor and outdoor pollutants may contribute to COPD. Genetics plays an important part in the development of COPD as well. Some individuals have the genetic version of COPD, otherwise known as alpha-1 antitrypsin deficiency. While very few people know they have this condition, it's estimated that close to 100,000 Americans have it. People with alpha-1 deficiency can get COPD even though they may never smoke or have not had long-term exposure to pollutants. There appears to be a connection with some asthma cases as well, so COPD and asthma oftentimes can get confused, and more commonly the disease affects adults over the age of 45. There's a lot of comorbid conditions that also align with COPD. These include cardiovascular disease, lung cancer, and depression. So people with COPD are not only the ones affected by the disease, it has far-reaching effects on families and caregivers as well.
Thank you, Dr. Kiley, for that overview. It is clear that the community building and awareness raising is needed to tackle this disease. Now I'll take I'll talk a little bit about the ways the COPD Foundation is taking action for COPD Awareness Month this November. 2016 marks the 5-year anniversary of the Go Orange resolution, the U.S. COPD Coalition's proclamation that named orange the official color of COPD awareness. Unveiled on Capitol Hill, the resolution was the coalition's answer to the call by the CDC to increase public awareness of COPD. The announcement to go orange came during a congressional briefing at the U.S. Capitol Visitor Center in Washington, D.C. Orange was selected as the official color as it represented energy, enthusiasm, determination, and success. That is why the theme of this year's COPD Awareness Month is Go Orange. On the 5th anniversary of the resolution, we hope to bring a renewed energy and enthusiasm to the community. So how can you get involved? First, we encourage everyone to join the COPD 360 social community. COPD 360 Social is an online network solely dedicated to COPD that allows members to share thoughts and ideas, ask questions, and communicate with peers, thought leaders, and respiratory professionals. At the same time, members are able to access educational materials, event information, support groups, research opportunities, and related resources. Join more than 20,000 members from over 100 countries in discussions around education and support for people affected by COPD. Second, we urge you to take the Go Orange Challenge by visiting copdf.co/go-orange. Submit a photo of you and your friends, family members, and pets wearing orange and share it with our COPD 360 social community. The photo with the most likes will win a $250 gift card. I'll take a moment to show you the Go Orange landing site where you are able to upload these photos. Here. Here you can see the landing site with the digital toolkit. If you click on the icons, you can download the collateral and share them with your social networks. We have social text, a MAT article that you can repurpose into blog form. We have videos that you can share, banners and buttons, and you can change your profile avatar to go orange. You can also plan an event or attend an event in your area. Here you can find the activity feed where you can upload your photo and then interact with other individuals' photos. Take us back to the presentation. We always stress the importance of caregivers in our COPD community, which is why I would like to turn it over to John Schall, CEO of the Caregiver Action Network. He's going to talk about National Family Caregivers Month and his organization's work to support COPD caregivers.
Thank you. We at Caregiver Action Network are proud to be a partner with the COPD Foundation to get these valuable messages out to all of you during this month of November. Besides being National COPD Awareness Month, November is also National Family Caregivers Month. And that's why I want to take a couple of minutes and talk about COPD from the family caregiver standpoint. When we think about COPD and 15 million people diagnosed with it, and probably that many again who have it and don't know about it, then you have to think then there's probably on the other side as many, another 30 million family caregivers who are helping care for those people with COPD. And that's what we want to talk about here. For National Family Caregivers Month in November, we have chosen the theme this year to be Take Care to Give Care. The reason for that is because family caregivers go through a lot of stress with the role that they have in caring for their loved ones. There are millions of us out there who are family caregivers of loved ones with COPD. My own mother has COPD. She's one of those who never smoked, but did get diagnosed with COPD later in her life. What family caregivers tend to forget is that while it's important, of course, to take care of your loved one, it's also just as important to take care of yourself. In fact, the first rule of taking care of others is to take care of yourself first. Caregiving can certainly be a rewarding experience, but it is also physically and emotionally demanding. The very stress of dealing with caregiving responsibilities actually leads to a higher cause of health issues for family caregivers themselves, who are much more likely to suffer depression or diabetes or high blood pressure just from the demands of those caregiving responsibilities. So as a family caregiver of someone with COPD, we want you to remember to pay attention to your own physical and mental wellness, making sure that you're getting proper rest and nutrition, because only by taking care of yourself can you be strong enough to take care of your loved one with COPD. And that's why you really do need to take care to give care, which is the theme for this month. Interestingly, most family caregivers will readily admit that they feel tremendously stressed in providing those caregiving responsibilities. They're doing everything from helping manage the medications for their loved one with COPD, to arranging the doctor appointments, to planning healthy meals. And of course, because it's a chronic condition, many people with COPD also suffer other chronic conditions. And so the family caregiver is managing kind of several conditions with them from several doctors and several different medications. The problem is family caregivers will neglect their own health. 3/4 of family caregivers will say that they miss doctor's appointments. 55% will actually cancel doctor appointments that they've already had. So you need to really remember to take care of your own health first. One thing we decided to do this month, in recognition of COPD Awareness Month, is roll out some new resources and videos just for caregivers of loved ones with COPD. Because sure, you can hear the messages from me as the CEO of Caregiver Action Network, the nation's leading family caregiver organization, but nothing compares to hearing it from caregivers of loved ones with COPD in their own words. And that's why on our website, caregiveraction.org, and you'll see that again at the end of this presentation for where you can go, we are launching some new videos of caregivers of loved ones with COPD, their experiences, and how they meet their needs and challenges. I think you will find these to be extremely helpful. And to remind you, as you're going through this as a caregiver of someone with COPD, because it's a chronic condition, remember that the family caregiving journey is a marathon, not a sprint. And you have to stay strong yourself to make sure that you're strong enough to care for your loved one, because this is a condition that you're going to be dealing with, the both of you, for quite some time. Please use the videos, but also know that on the caregiveraction.org website, there's all sorts of resources and materials for helping you do the caregiving duties that you need to do, putting a patient file together, how to manage medications, lists for doctors' questions, everything from how to manage the financial burden to understanding Medicare. So we're there for you, and we're proud to be putting out these messages for caregivers of loved ones with COPD here in National Family Caregivers Month. Thank you.
Thank you, John. Now we will talk about the ways we can take increased general awareness and convert it into action. Dr. Puntieri will be sharing information about the recently released National COPD Action Plan.
Thank you. I'm going to update you on the COPD National Action Plan. And following a request from members of Congress in 2014, NHLBI organized a series of preparatory workshops to begin planning for the development of the National Action Plan for COPD. In early 2016, more than 200 stakeholders gathered for the COPD Town Hall to discuss recommendations to be addressed by the COPD National Action Plan. And along with partners, NHLBI is developing right now the Unified COPD National Action Plan based on the Town Hall recommendation. If you put 1, 2, 3 together, you can see how the concerted efforts of the COPD community, patients, family, and caregivers, healthcare providers, industry, legislative entities, academia, researchers, resulted in a comprehensive action plan that will impact the lives of millions of people affected by COPD. But these pictures of these arrows following each other underscores the fact that this is an iterative process. The plan is an open document that is subject to revisions and modifications in line with the needs and opportunities, success and failures that will occur inevitably during this implementation. Our work so doesn't stop here. The action plan will be a living document for the COPD community, and we will see it evolving along the years. The COPD National Action Plan proposed 5 goals. The 5 goals cover the entire spectrum of the disease care. Each goal has several objectives that are designed to provide further guidance on how to achieve the goal. Goal 1, empower people with COPD, their families, and caregivers to recognize and reduce the burden of COPD, is aimed primarily at educating and supporting people with COPD at risk for the disease and their families and caregivers. Goal 2, improve the prevention, diagnosis, treatment, and management of COPD by promoting and sustaining the education and training of healthcare providers, is geared toward healthcare providers' education and training in the disease. Goal 3, collect, analyze, disseminate, and report COPD-related public health data that drive change and track progress, is addressing the need of collecting and analyzing data that inform public health decisions. Goal 4, increase and sustain research to better understand the prevention, pathogenesis, diagnosis, treatment, and management of the disease, is designed to further research in COPD. Goal 5, finally, translate national policy, educational, and program recommendation into legislative research and public health care actions, ensures that the efforts of the other goals result in tangible actions that impact public health. How to involve caregivers. As you have seen, especially Goal 1, empower people with COPD, their families, and caregivers to recognize and reduce the burden of COPD, is specifically related to the National Family Caregivers Month. Among the objectives that this goal wants to achieve are offer every person at risk for and living with COPD, as well as their caregivers and family members, ready access to free, reliable, and up-to-date COPD information and resources. Increase the effectiveness and expand the range of outreach communication campaigns designed to decrease the burden of the disease. And finally, expand opportunities to increase COPD awareness across the public-private spectrum. Visit the NHLBI COPD Learn More, Breathe Better website for more information on the COPD National Action Plan. We also have fact sheets specifically for caregivers. And if you have any questions or suggestions, please do not hesitate and email us at copdactionplan@porternovelli.com. What else can you do? Clearly, there are 5 basic targets. Know the symptoms of COPD to recognize them early. Talk about COPD with your loved ones. Suggest a visit to the healthcare provider and others to come along. Help them stick to a treatment plan, and offer always support and resources. Thank you.
Thank you to everyone who joined us on this webinar. We hope this will equip our patient and caregiver communities to mobilize and take action this November. Please feel free to reach out to us and follow the links here for more information.